do you have to be asleep?
So if you're going to have surgery, it's best to be asleep. If we're doing smaller procedures, we can do it with you sitting in a chair. So it really depends on what we're doing. I'm not a big advocate of doing surgical procedures on people while they're awake. I think it's safer for you to go, it's safer and you're much more comfortable for you to go to sleep when you're having a surgical procedure. Being half awake, worrying about your airway or if you're going to breathe or, what your blood pressure is, all those kinds of things. I don't want to do that while I'm trying to do my procedure on you. And I don't want to be hurting you when I'm doing a procedure. And if you are hurting someone during a procedure, it really is stressful and it's hard to focus on what you're doing. And so when I do surgical procedures, I want an anesthesiologist there who's absolutely expert, who puts you to sleep and keeps you very comfortable. And their whole focus is that you're safe and that you're not feeling anything. And then I can do my procedure and not stress about hurting you or whether you're taking enough rest or a deep enough breath or what's going on with anything, because I have an expert there who's much better at it than I am anyways. And they're sort of taking care of that. We find that is safer, it's smoother, the procedure goes faster, and we can get a better result. This idea of doing stuff half awake, I'm not a big fan of. I think it came from places that don't have access to surgery centers or aren't trained and qualified to be able to go into surgery centers. And it saves you a few bucks to do it that way. And so I've sort of never been a fan of that. I really, really enjoy using the anesthesiologist for all of our bigger surgical things.